right, next we've got our two speakers from the Developmental Disability Division. I had to think about that one because I'm trying to talk and spotlight at the same time. So we've got Dr. Ryan Lee and also Debbie Ueda from the DD division, and I'm going to let you guys take it on.
Thanks,
Switch
Amanda.
interpreters.
Okay. Should I hold for a second?
Nope, you're good to
Okay, good. So I'm Ryan, medical director at DDD, and Deb is gonna share slides here with you guys for our presentation. Okay, so as Eric mentioned, we're the Developmental Disabilities Division, and we are a division within the Department of Health under the Behavioral Health Administration. And today I'm going to share with you briefly about eligibility, and then we're going to try and spend the bulk of our time on services through the waiver. Slide. So what we do as a division is support people with intellectual and developmental disabilities. You heard a bit about self-determination. That is a core of what we do also, and we want to provide person-centered, family-focused services for people with disabilities throughout the state. Next slide. Some of the eligibility involves citizenship and a diagnosis. So the diagnosis of intellectual or developmental disabilities are defined in our Hawaii administrative rules. And I'm going to go over them on the next slide.
Okay.
Okay, so intellectual disability. We adhere to the DSM criteria for the most part, and the qualified providers to be able to diagnose it are psychologists or other licensed professional that DDD has requirements for. And what we're looking for is not only a clinical diagnosis through symptoms that start before the age of 18, but also concurrent substantial functional limitations in major life activities. And these are measured most of the time through a Vineland or an ABAS, which are standardized testing. And they involve areas such as how somebody cares for themselves, how they communicate, learn, mobilize throughout the community, have self-direction, have a capacity to live independently, and can have economic self-sufficiency. Next slide. The other category of diagnoses involve developmental disabilities, and they largely fall into four categories. The three diagnoses are cerebral palsy, epilepsy, and autism. And there's a last category called neurologic conditions having to do with the central nervous system or genetics. But the second part of that within our administrative rules says that even though they have a neurological condition, they still must have substantial impairments in intellectual functioning and adaptive behavior similar to that of a person with intellectual disability. This is in keeping with our history of being founded in our purpose to support people with intellectual disabilities. But for the developmental disabilities, the onset age is different. Symptoms must onset before 22. Still, they must be likely to continue indefinitely and adhere to the functional limitations, as I mentioned previously. Next slide. There is a list of conditions that we say cannot be the primary cause of one's functional impairments if you're applying, and this is the list. And the reason for this list is because these are better served through other avenues or agencies, such as, the adult mental health division or child and adolescent mental health division. And so while individuals with intellectual and developmental disabilities have co-occurring or comorbid conditions such as these, their impairments cannot be primarily caused by these. They must be primarily caused by the diagnoses of intellectual and developmental disabilities. Next slide. We have intake office throughout the state that may be contacted if you're interested in applying for DDD. Next. What happens? So we'll get a phone call in our intake offices The applicant is requested to gather supporting documentation for their application, which involves diagnoses and other things, such as DOE documentation, IEPs, psychological evaluations, etc. And then they will meet with an intake worker and have an intake interview. The intake worker will review it with the clinical team and see if there's additional information that needs to be gathered in order to support a complete application for review for eligibility. Next step. Next slide, sorry. So what happens after a decision's made? So it's possible that you're not eligible, and there are many reasons for that. So when I mentioned substantial limitations in those functional areas, our statutes discuss that the criteria is high, the bar is higher, meaning that we service the most substantially impaired individuals that have 3 standard deviations of impairment rather than 2. And so that may be a reason why they may not meet eligibility. They may not have an eligible diagnosis, or their diagnoses in other areas that I mentioned, such as mental health, might be the primary cause of their impairments. If you're not eligible, you can appeal the decision and it goes through another avenue. And we provide information on that. And we also provide recommendations for other services in other areas, such as through your health plan, healthcare providers, and other state agencies. If you're eligible, then the case is transferred into our case management branch. So it goes from intake eligibility, case management takes over, you get assigned a case manager, and they begin looking at waiver application, which is the second step in getting waiver services, which is the bulk of our services provided for individuals with developmental disabilities. Next slide. I'll let Deb take over from here since we're moving into the case management area. Go ahead, Deb.
Hi, good morning. Can you hear me okay?
Yeah.
Okay. My name is Debbie Ueda, and I'm a supervisor at Case Management Unit 8. My unit handles West Honolulu, but we do have cases all over the island. So it was very appropriate that Eric Folk was sharing about self-determination, because as case managers, one of the main things that we would like to do is to support individuals in living person-centered and self-determined life. That's one of our objectives. And so through our service planning process, we work closely. Anyway, so in regards to self-determination, the primary service we offer at case management branches ourselves to help support the individual and their families. As Dr. Lee had mentioned, the primary service that we're associated with is our Medicaid Waiver program. So the bulk of this presentation will be on the Medicaid Waiver program. But in the chat box, I did share the brochure so you can take a look at it. And I just wanted to share a part of that right now, if I can. I'm going to share that just so you can see it. Okay, so this is the brochure that I put in the box. So it does talk about the different Oahu units available here in Hawaii and the phone numbers associated with it. You would have to go through intake first to be found eligible and be assigned a case manager, as Dr. Lee had mentioned. As far as case management, the primary service we do offer is ourselves. So we would do an assessment, we would do a service plan with the individual and their family and their circle to try to identify what the needs are, what the supports are, what you're looking at in regards for services for yourself or as a parent for your child. We try to identify not only services available through our system, we look at natural supports as well. So we cannot duplicate or supplant services available through other systems. We try to identify how we can support them. The other service that we can offer individuals is our Medicaid Waiver program. So that's what I'm going to talk about now, but not everybody qualifies for the Medicaid Waiver program. In order to qualify, you have to qualify for Medicaid, and you also have to be ICF level of care, which stands for Intermediate Care Facility. So for individuals who don't qualify for the Medicaid Waiver program, then we can assist with transition planning if we're invited to the IEP. We don't have an insert in the IEP, as some other offices do, but we can assist and we can complement the services available to individuals throughout their lifespan. Okay, so I'm going to go back to the slides. Can you see the slide okay?
Yes, we can.
Okay. Okay, so Home and Community Medicaid Waiver Program is for individuals with developmental disabilities. And as I mentioned earlier, it's as an alternative to long-term care, institutional care, and it assists individuals to live within their home and community. So the whole idea behind this program is to support individuals who are at risk of institutionalization within their home and community. And that's why Medicaid, if a person qualifies, is willing to pay for this service. You know, fortunately in Hawaii, we were one of the first states in the nation that did close our institution. I think we were actually. The waiver services complement and supplement services available to individuals through the Medicaid state plan and other federal, state, and local public programs, as well as the supports that families and communities provide. And I can't stress enough how important this is because, you know, a lot of these services may look good, but it's trying to access the services too, because right now, I think even in the news this morning, they were talking about the shortage of direct support workers, and it really is a problematic situation. But these are some of the services that we do offer underneath our Medicaid waiver program for individuals who are eligible. We do offer adult day health programs out in the community. Some of the agencies that you may have heard about, for example, is Association ARC in Hawaii, SECO, Easter Seals. They all have day programs, but a lot of them do have wait lists. And following the pandemic, some of them are limiting the number of people in their program at any given time. So planning is very, very important. And that would only be for individuals when they exit the Department of Education. Personal assistance habilitation is in-home services for individuals, and that can assist with bathing, grooming. Again, we don't want to take away from the parents' responsibility, especially for the young children, but hopefully we can provide some assistance and provide, again, to support the individual and their family. Residential rehabilitation is a service we offer for individuals who live out of home, like some of our adults who live out of home. Chore services are available primarily for individuals who live independently. However, if they're able to do their own chores, like we would assist them, and it would be called PAB and not chore. Chore is primarily for people who physically cannot provide that service, or individuals who live with elderly parents who cannot do chore-like activities for themselves. Respite is a very popular program, sometimes hard to come by, but respite is basically to help provide relief to the parents and their families, like if they were to go out in the evening, or even respite for the individual themselves. Private duty nursing, again, for private duty nursing, we can't duplicate or supplant services. So for children under the age of 21, I believe, Dr. Lee, is that right? We would have to go through the health plan for that service. Specialized medical equipment and supplies, again, we can't duplicate or supplant services. So for the most part, anything medical would go through the health plan. So we very seldomly have to provide specialized medical equipment and supplies. Training and consultation is also a service that's primarily for our adults, because for school-aged individuals, they're able to get a lot of the therapy services through the Department of Education or through their medical plan. That is a service we do offer. Crisis mobile outreach and out-of-home stabilization, that would be for adults as well. We can do some of the crisis mobile outreach for younger individuals if there's behavioral issues, but it's somewhat limited. Community learning services include both group activities. Usually that's associated with the adult day health program, where you would be going out in the community to do different activities. But there's also community learning service individual. We're really trying to get away from congregating people in centers. Although on the other hand, a lot of the individuals we support with, they've developed lifelong friendships in some of these programs. So it's important. It's something that's important to them. So it's really individualized. But for community learning service individual, that would be a one-on-one support. And again, it's not where the direct support worker wants to go, but it should be where that individual wants to go and what type of activities. So that would be outlined in the individual service plan. Discovery and career planning is a service that, again, we cannot duplicate and services, but if there's a service available, we would look first through the Division of Vocational Rehab. But for individuals that may be waitlisted for DVR, for example, we are able to offer sometimes short time discovery and career planning while we're waiting for DVR, where maybe they can explore different career opportunities and options and help them to try to consider what they'd like for their lives. Individual employment supports, again, that's not something we can duplicate, but hopefully we can complement what DVR is able to offer. Assistive technology, sometimes that's available through the health plans, but in some cases we can provide that. Environmental accessibility adaptations, like if a person, there's a lot of paperwork involved in some of these and we have to make sure it's appropriate, but if a person, like let's say, needed a ramp built or a door widened or modifications to the bathroom, that's something that potentially we could offer along with vehicle modifications, non-medical transportation. So if it's related to medical, then it would go through the health plan. But if it's being able to access or get handy van tickets, that might be something we could offer. Personal emergency response systems as well. Before I go to the next slide, was there anything you wanted to share, Dr. Lee? No? Okay. Okay, as far as the eligibility criteria for waiver, they have to be first eligible for the Developmental Disabilities Division and meet the ICF level of care, which stands for Intermediate Care Facility. So what happens is we would go through the primary physician, and the primary physician would have to fill out some paperwork indicating the person is ICF level of care, which stands for intermediate, and they have to be eligible for Medicaid. For some of the individuals that are under the age of 18, we can go through a deeming process. So the family would have to, if they don't qualify for Medicaid outright, they would have to disclose their income and assets, and that would have to be reviewed. And the type of services that we would be authorizing through the Medicaid waiver program, plus any out-of-home expenses, would have to exceed that threshold. So that's something the Department of Human Services would determine, because even going through the deeming process, not everybody is eligible. But for adults over the age of 18, 19 years old, they may qualify for Medicaid outright. So it is important to plan. If this is a service that you're looking at for yourself or for your adult child, then it's important to plan as far as your assets. You can't have income over $2,000 in that person's name to qualify for Medicaid. There are trust funds, there's ABLE accounts, there's other ways to kind of work around that. But so how do we authorize the services? It's really authorized based on the individual needs and service plan. Again, we can't duplicate or supplant services, but we do have a guide as for our adult clients. We do something called the supports intensity scale. The supports intensity scale in itself is really supposed to be for planning, and it's an incredible tool that we do every 3 years for all of our clients. And it might give us different ways to think and how to what kind of services might be interesting or available for that individual. And but it also helps us develop a supports level and individual support budget. And it's based on where they live. If a person lives in a licensed or certified home, a lot of the budget is built in already into the residential habilitation services. So the services we can offer, like adult day health, community learning service, individual path, is more limited. If they're living with family or living independently, their budget is a little bit bigger. So this is our website, and there's a lot of great information available in there. And you can also take a look at the brochure that I put in the chat box. And unfortunately, I'm not going to be available this afternoon for the question and answer, but fortunately, Dr. Lee will be available. Was there anything, but we just wanted to, again, thank you so much for everything, and appreciate your patience with us. Dr. Lee, was there anything you wanted to share?
No, thank you, Deb. I think that we just have a couple minutes left to answer a few questions. Is that right, Amanda?
Yep, that's exactly right. We have about 5 minutes to answer questions from the chat. And then also we'll have this panel discussion later, which Dr. Lee will be available to us. So if we don't get your questions right now, please wait, and we will have time And also, if you see something, Dr. Lee or Debbie, in the chat that you could address, feel free to go ahead and answer those, okay? But
Okay.
Michelle,
Yeah.
Anna?
Yeah. So there were a few questions in the chat regarding eligibility. Like I think a few families had written that they applied, but they were denied. The Dr. Uehara. So I don't know if you want to address those.
I can attempt to address those. I don't know those cases specifically.
Yeah.
And I may not be able to address your specific situations where you were denied eligibility, but I can say that regarding Dr. Uehara's question about changing the criteria for eligibility, I think that's unlikely. We are mandated to not have a wait list. And so in doing so, we service, like I said, that smaller population, which is about 3,000 throughout the state at this time. If we were to extend the criteria to be 2 standard deviations, then that would mean at least 20,000 must be serviced, and there are fiscal and programmatic implications to that wouldn't make that feasible along with the waitlist mandate. So that's unlikely, Dr. Uehara, to occur. And then regarding specific cases, if you have questions about them, you can feel free to contact our offices and we can discuss why the individual was not deemed eligible. Just because you have a diagnosis does not mean that you're going to be eligible. And yes, Medicaid is something that you have to be eligible for in order to get waiver services, because the waiver is carried out by us, but Medicaid criteria is essential to receive the services. So there are other ways to work that out, and you might want to just talk to case management or intake worker about some of those specific questions.
There was one comment. If my daughter is eligible for Medicaid as an adult, is it more likely that she would be approved for DDD services, even though she was denied as a minor?
Yeah, so there's 2 steps to eligibility. The first one that I discussed is DDD eligibility. And so you can become eligible for DDD, but not be eligible for the waiver. You've got to apply for the waiver afterwards. If you're an adult and you're Medicaid eligible, then yes, it's highly likely you'll be eligible for the waiver if you meet the DDD criteria also. Often we see individuals who apply earlier, say in pediatrics, might not get in, but as time goes on, their functional status declines a bit, and then they show that they have needs in major life areas that reach the criteria. So we do see that sometimes in our eligibility determination.
There was a question about does DDD provide benefits planning seminars and workshops? And so Gail, I don't know if DDD provides it, but certainly other organizations provide seminars and workshops. So SPIN is one that's coming up in April. So April 22nd, we have our SPIN workshop. PAC-RIM is a little bit low. Amanda, do you have others? LDAH, the Learning Disabilities Association of Hawaii, they have sometimes these little marathon sessions where you can sign up on various topics. So please look out for those. I don't know if Dr. Lee or Debbie, if you want to comment if DDD provides those benefit planning workshops or seminars.
I'm not familiar with any of them through DDD. Deb, are you?
Well, for some individuals who qualify, let's say for discovery and career planning underneath our Medicaid Waiver program, that's a contracted service that we would go through that, benefits planning have to be included in that. Sometimes we have worked very closely with the Centers for Disability Studies as well for that particular service. Is that correct, Dr. Folk?
I wish I was a doctor, but I'm not yet. Anyway, yes, we have a benefits planning contract service that you can reach us through our website. It's also contracted to DVR. And so if you're a DVR client, you can get that support as well.
And I'll say one thing before we close and move on to the next speaker. If it seems as if the bulk of our services are geared towards adults, you are right. The DDD does provide services to children age 0 to 21, but those services are primarily in the areas of respite and in some cases, some PAB or CLS, but for the most part, the services for children with disabilities until 21 are primarily supported by the health plan benefits and through the DOE. And the health plan benefits involve EPSDT or early periodic screening, diagnoses, and treatment. And so they are designated through the through DHS to be the primary supporter for children with disabilities. And so I know people are told apply DDD early, but then they wonder, well, why am I not getting the services? It's because we must redirect you to those resources first as primary, as DDD is not the primary during the pediatric age. Thank you.
Oh, and I just wanted to compliment that and saying that for those younger children, we can help with the self-determination planning, like Dr. Folk or Eric Folk, I'm sorry, Eric Folk was sharing, so the service planning process for individuals who aren't in the Medicaid waiver program, we're required to do an annual assessment and service plan, and we're available as a resource to the individual and the families throughout the year. We would be more in the back seat, but we are available and we can assist in that. So that would be the case management piece. So in order to keep the case open, even if you're not receiving any active services, we have to do an annual assessment and service plan. And as a case manager who's been with our division now for 30 years, it's been really fun to see the progress that people have made, through that annual planning process. And we really want the individual in that driving seat. We want them to make the decisions for themselves. And that's been a real evolution and thanks to our partners.
Awesome. Thank you, everybody. Really, really appreciate that talk. I know that it's challenging for Dr. Lee and Debbie to answer questions based on personal questions and circumstances, but we do appreciate your time today sharing. And if you have other questions, go ahead and put them in the chat because they might be able to answer them for you. And right now we're going to take a short little break. Okay, so about about minutes now.
Sorry.
Oh,
I just wanted to share really quick that if a person isn't eligible or is not happy with services that they're currently receiving, that they can reach out to either the supervisor of the unit, or if it's an eligibility issue, there is an appeal process that they can also go through.
Thank you for that. And that's right. There is an appeal process. And if you've tried before and got denied, it doesn't mean you can't try again later on, right? You can still go through that process again. Because we did see in the chat, someone did it early when their kid was younger and it was more difficult, and then they got accepted later on. So keep trying, don't stop, and do try the appeal process.